Capsule endoscopy is it a rival to conventional endoscopy? Endoscopy is a non-surgical medical procedure performed to view the inside of hollow organs and cavities of the body, such as the gastrointestinal tract, in order to investigate, diagnose, and treat any potential abnormalities. Two types of endoscopies include the capsule endoscopy and the conventional endoscopy. Each of these types of endoscopies are minimally invasive and are designed to conveniently view specific parts of the body. They are easily inserted into the natural openings of the body, such as the mouth or the anus.
The use of capsule endoscopy is aimed at recording images with the digestive tract for diagnostic measures in the medicine. The capsule endoscope is highly effective at pinpointing bleeding in the secluded area of the small bowels. Capsule endoscopy is executed firstly by swallowing a capsule which then travels smoothly through the digestive tract into the stomach, through the small intestine, and then the large intestine. A wireless recorder is tracked around the waist, where it tracks signals transmitted by the capsule while it progresses through the gastrointestinal system. Images are scanned during this process, and the capsule is naturally excreted at the end. This is the mechanism of the capsule endoscopy. As you can see, it consists of an antenna, battery, lens, and lies within one capsule.
Conventional endoscopy is a process where a long, flexible fiber optic tube is inserted into the body to observe images of internal organs for accurate diagnosis. The conventional endoscope can be passed through the mouth and into the esophagus, stomach, and duodenum for examination. Alternatively, the conventional endoscope can be used to examine the rectum and lower colon, where the flexible fiber optic tube is passed through the anus. During these procedures, although they are minimally invasive, mild sedation or pain medication can be administered to ease any discomfort for the patient. The conventional endoscope is made up of a long, flexible tube, light, lens system, eyepiece, and an additional system that enables other medical instruments or manipulators to be passed through the endoscope into the body. Attached to the endoscope is also a small camera which transmits images obtained to a monitor for close examination.
The endoscopy allows the doctor to diagnose your internal organs without making large incisions. It helps doctor gaining more accurate understanding the possible cause of your symptom, and it also helps them determine whether the treatment can be treated without surgery or endoscopy. The conventional endoscopy is used to detect the problems in the lining of the esophagus, stomach, and the first part of the small intestine. This method cannot detect the problem within the small intestine due to the inconvenience of the insertion tube, which is large and not long enough to reach the small intestine. However, the capsule endoscope can be used to figure out the cause of bleeding and other symptoms within the small intestine. Here is the disease that can be diagnosed by the endoscopy. The conventional endoscopy can be used to detect the gastroesophageal reflux disease. As we can see on the picture, the muscle fibers in the lower esophagus prevent the swollen food moving back up. These muscle fibers called lower esophageal sphincter. But when the muscle fibers cannot be closed on the way, the stomach can then move back to the esophagus, which cause heartburn and other symptoms. The conventional endoscopy is also flexible to find the tumor cell lining on the esophagus. The conventional endoscope can be used to detect the peptic ulcer disease, which is a painful sore or break in the lining of the stomach or the first part of the small intestine. It may be asymptomatic or symptomatic, and most ulcers are caused by bacterial infections called Helicobacter pylori. The conventional endoscopy can be used to find the Crohn's disease, which causes the inflammation of bowels. It commonly affects the lower small intestine and large intestine, but may affect the digestive tract from mouth to anus. The inflammation extends through the entire thickness of the bowel wall. It may cause abdominal pain, diarrhea, and other symptoms, including fever and weight loss. However, it cannot detect the Crohn's disease in the small intestine, With the flexible of the capsule endoscope, we can detect the various symptoms within the small intestine which cannot be detected by traditional endoscope, such as the angiodysplasia, which is the small vascular malformation of the gut. It can be considered causing of unexplained bleeding and anemia in the gut. The capsular endoscopy can be used to detect the celiac disease, which is a disorder affecting gastrointestinal tract caused by chronic inflammatory of the mucosa. The disease causes the patient are very sensitive with gluten. It leads to the atrophy of the intestinal villi and malabsorption. The disease is strongly associated with skin disorder, causing rash or redness. It may also find the polyps within the small intestine, which is a painless, non-cancerous tissue, and it may cause disease if it's lying in the intestine for a long time.
The capsule endoscope has various pros compared to the conventional method. Although there are some disadvantages to the capsule, they are greatly outweighed by the advantages. This capsule technique provides more detailed images compared to the conventional method. This is because the capsule is able to go through the entire small intestine, even into difficult to reach areas, and provide doctors 3D color images of the organ without surgery. Through this, it allows doctors to make early, accurate diagnosis of problems so an appropriate treatment can be recommended. This is also a painless technique where a small wireless capsule is swallowed. Therefore, anesthesia is not used and the recovery time is minimal. In contrast, traditional endoscopy uses a rigid tube to view internal organs, which makes it difficult to reach the entire small intestine, and local anesthesia may be needed. Furthermore, the traditional endoscope poses greater risks than the capsule, as a rigid tube may puncture the internal lining of organs and cause bleeding, which could lead to infection. The capsule, on the other hand, has lower risks of complications. Conversely, the newly discovered capsule does have some disadvantages, including difficulties in determining the exact location of any abnormalities discovered, whereas the traditional method is able to exactly identify its location using real-time data. Furthermore, if the abnormalities are discovered using a capsule, it means it is impossible to resolve the issues at the current time and a biopsy is still needed, which can only be conducted through the use of the conventional endoscope. The capsule endoscope is also controlled by a gut peristalsis. Therefore, doctors lack control of the direction of the capsule and the speed at which it travels, which may mean the abnormality is not detected. On the other hand, the traditional method is controlled by the doctor holding the end of the tube, directing the angle at which the camera faces to view the suspected damage. Therefore, it is evident the capsule endoscopy method may be preferred over the traditional method. However, patients with the implanted electromagnetic devices cannot utilize this tool because it can disturb these devices, causing delays in programming or recalibration. Thus, the conventional method is preferred for patients with electromagnetic.
As technology rapidly advances and knowledge is broadened, clinical applications of capsule endoscopy will also continue to progress and improve. Advancements to capsule endoscopy, such as the use of quality multi-element lenses and adaptive illumination, permitting an enriched image clarity and wider angle views, provides a promising development. In the near future, we will begin to see the development of steerable capsules and even self-propelling capsules. The development of these capsule endoscopes epitomizes a leap in the evolution of medical technology, as it allows an active process of movement of the capsule through the gastrointestinal tract, where targeted areas can be specifically analyzed. Steerable or self-propelling capsules will also be beneficial in the future, as they will allow drug delivery and targeted biopsy procedures to be performed with ease. As it is currently difficult to know the exact location of a lesion discovered by the capsule, new devices are under study to associate some kind of odometer to an endoscope capsule using an algorithm, allowing doctors to have precise localization of the lesion. Therefore, the necessary course of action can be taken. The capsule endoscope is the better alternative to the conventional endoscope, as it has the potential to become even more advanced in the future, with more and more research being conducted to improve its disadvantages.